Good morning, sir.
Good morning.
Sir, today a patient came to our OPD with fever since 3 days. Can you please suggest a remedy for this case?
Okay, is it diagnosed or yet to diagnose?
It is not yet diagnosed, sir.
Okay, what are the ailments in this case?
Sir, actually, on Sunday, patient went with his friends and had various kinds of food like ice creams, sweets, and spicy food. And apart from this, there is no any other ailment.
Okay, this symptom you have to consider it as an indiscretion in diet of patient had different types of food at different intervals. So you have to take this as an indiscretion in diet. The probable drugs for this symptom are pulsatilla, ipecac, and mainly nux vomica. So after the complete totality, we will differentiate and find out what is the most probable drugs. Yeah, what is the prodrome in this case?
Sir, patient developed headache, nausea, and followed by retching on the next day.
Okay, so onset is gradual. Like what about chills?
Sir, patient had chills before fever and he is
Okay.
not comfortable in warm room
Okay.
but feeling better in open air.
Aggravation warm room, it is a typical modality peculiar. Amelioration in open air, that too in chills. Okay. What are the other symptomatology?
Sir, patient is having high grade fever, nausea and vomiting, and there is dry cough with slight difficulty in breathing.
Okay. Dry cough with difficulty in breathing. Right. What about generals?
Sir, generally patient is thirstless, but now he is having thirst.
Okay, generally thirstless, that's a good point. So we have to collect before to the now diseased condition. So patient in healthy state he is generally thirstless. Now he is
Having
thirsty. Yes, good.
and there is loss of appetite.
Loss of appetite. Okay.
And as I examine tongue, it is clear and pale.
Okay. Clear tongue and pale and with nausea and vomiting. Okay. Any aggravations and amelioration? General modalities?
Sir, aggravation from warm room
Okay.
and amelioration from open air.
Open air. So this is the totality you find in this case.
Yes.
So first from ailments, indiscretion in diet, you got pulsatilla, ipecac and nux vomica. So after coming to the symptomatology, here you have the more symptom predominance of nausea and vomiting along with high grade temperature and dry cough. Okay, coming to the dry cough, there are another probable three drugs you have to remember in this fever. Dry cough with stitches in chest is aconite. Dry cough before chill stage is rustox. Dry cough during chills and fever is bryonia. So here dry cough along with difficulty in breathing is there. So those three are also ruled out. Coming to the nux vomica is more chilly patient. He is very better in warm room. So aggravated in open it. So you have to rule out nux vomica. So coming to the pulsatilla and ipecac, both have ailments from indiscretion in diet. Both are thirstless and both have dry and difficulty in breathing and most importantly open air amelioration. But coming to the tongue, pale and clear tongue along with nausea and vomiting is more predominant in ipecac. So here you have to rule out pulsatilla. And more importantly, not only in this case, in general, chill stage is very more in pulsatilla, heat stage is very little. While coming to the ipecac, chill stage is very short and heat is very high grade fever and general thirstless. These are the differentiating features. So coming based on this totality and the probable drug is ipecac.